Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hello all, this is Lucas and I look after corporate healthcare here at GPDQ. We have our clinical director on with us today, Dr. Karthrina Crystallis. We're going to talk about something really topical this is COVID vaccination during pregnancy.
Perfect, thank you, Lucas. So COVID-19 vaccinations are recommended in pregnancy, but obviously the decision as to whether or not to have the vaccine is an individual choice. So we wanted to help provide some information to help women who are pregnant make informed decisions. And the information that we've taken today, it's from the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, and also the Joint Committee on Vaccines and Immunisations.
Excellent. So let's get started with some of the most common questions. And the first one is, what are the risks of COVID-19 in pregnancy?
Perfect. So actually the risks of COVID-19 in pregnancy, roughly half to 2/3 of women who test positive for COVID-19 in pregnancy actually have no symptoms at all. But there are risks to both the pregnant women and also the unborn baby from COVID-19. So for the pregnant women, there is a risk, and this is in comparison to non-pregnant women, of hospital admission and severe illness. And this is especially during her third trimester. And for the pregnancy, there is an increased risk of complications, and these include prematurity and also stillbirth.
Right, understand. And what are the benefits of vaccination in pregnancy?
So as we said, the vaccine is recommended, and it's recommended to help try to minimize some of these risks. So vaccination is the best way to protect against the risks of COVID-19 in pregnancy for both the woman and the unborn baby. So just to summarize, it can the risks that we discussed, it can help reduce the risk of severe disease for the pregnant woman, help reduce the reduction in stillbirth and prematurity for the baby. And actually, some studies have also shown that the antibodies from the vaccination do cross the placenta, so it helps the baby's immunity to COVID-19 as well.
Okay, well, that's useful. And what sort of latest advice on COVID vaccination is in pregnancy?
So the latest advice is the vaccine is recommended for ladies who are pregnant, and all pregnant women in the UK aged 18 and over have now been offered a COVID-19 vaccination.
Yeah, and another question, I guess, that a lot of women sort of ask themselves. So is COVID vaccination safe and effective for pregnant women and their babies?
Yeah, obviously it's a really important question. And the real world data, so this has been collated from the United States. There's been over 148,000 women who have been vaccinated. They've mainly been vaccinated with the mRNA vaccines such as Pfizer and Moderna, but out of those 148,000 women, there's not been any safety concerns raised. In addition to that, the Public Health England have reported that in the UK, there's been more than 62,000 pregnant women who have received at least their first dose of the COVID-19 vaccination, and there's not been any serious adverse effects that have been recorded. So the COVID vaccines that are used in the UK are not live, so there's no reason that you or your baby would become infected with COVID-19. And actually, for a long time now, we've been using other vaccines that are not live as well in pregnancy, which are safe, such as those, the flu vaccine, for example. So it's not new to give vaccinations in pregnancy.
Well, that's very reassuring. So another question that's kind of popped up quite often is, are there any evidence that COVID-19 vaccine cause miscarriage or stillbirth?
Okay, so the MHRA, the Medicines and Healthcare Products Regulatory Agency, it's the UK's way of, or system of collating and collecting information that monitors safety concerns such as suspected side effects or adverse effects with medicines or vaccines. They say that there is no pattern from the reports to suggest that any of the COVID vaccines used in the UK or any reactions from the vaccine can increase the risk of miscarriage or stillbirth.
Okay, good news. So, and another one that I guess is quite important is, when in pregnancy can an individual, a pregnant lady, can actually have the vaccine?
Okay, so the vaccine is considered to be safe and effective at any stage of pregnancy. So no evidence to say you should delay it until after the first 12 weeks, for example, of pregnancy. At any stage you can have the vaccine.
Okay, perfect. And yeah, you've obviously touched on the mRNA vaccine and obviously with other available. So does it matter which vaccine pregnant lady gets?
Okay, yeah. So
Mhm.
based on the studies so far and the information that's been collated in America, so the Joint Committee of Vaccines and Immunizations advises that actually it's preferable for all pregnant women in the UK to be offered either Pfizer or Moderna
Okay.
where it's available, because of the information that has been received already. If, however, you've had a first dose of AstraZeneca before you're pregnant, the advice is that you continue and have your second dose with the AstraZeneca as well.
Okay, right. So it's just based on the research, I guess. And does that was a quite common question, I remember back in the day. So does the COVID vaccine affect your fertility?
Okay, so yeah, there's no evidence to suggest
Mhm.
that COVID-19 vaccines affect fertility. And as you said, there was a theory or a rumor in the past that the vaccine could affect your fertility through the spike protein, but actually there's no evidence to support this and no evidence of fertility problems in people that have already had the vaccine to COVID-19.
Okay, that's great. And yeah, I mean, one of the last questions here is, and also quite common, is if a woman is breastfeeding, can she have a COVID vaccine as well?
Absolutely. So
Yeah.
yes, the COVID-19 vaccines are recommended to breastfeeding women, and so you don't need to stop breastfeeding in order to have your vaccination.
Hey, this is brilliant and super, super valuable as always. So thank you ever so much. We have some additional links that we'll share with that video so that you could do your own research and have a read yourself. So thank you so much, Dr. Karthrina.
Thanks, Lucas.
Yeah, thank you all for listening. Do tell your friends and do remember this week to put yourself and your health first.